Cristina, could you please introduce yourself again, a little bit about yourself?
Okay, well, my name is Cristina Sanchez. I'm a professor of biochemistry at Complutense University in Madrid, Spain. And I have been working, studying the anti-tumor effects of cannabinoids for the last 15 years.
Okay, well, thanks, Cristina, for that. And thanks for the opportunity to do this interview. It's fantastic. And just to tell the listeners that we just talked for about a half an hour, and technology failed us, and the recording didn't actually record. So my apologies for that, Cristina, but we'll give it another attempt. And thanks so much for your patience.
It's okay.
We did have a great conversation, didn't we, prior to this this technical error. So, Cristina, what were we talking about? What was the
cannabinoids, probably, and cancer?
Probably we were probably talking about cannabinoids and cancer. And we did start to talk about the Dennis Hill interview and the things, the actual issues that you didn't agree with Dennis's interview. And I'm sure Dennis would be really interested in that as well.
Okay.
So
well, the first one was regarding the amount of THC and CBD that a cancer patient has to take in order to cure his or her cancer. Well, first of all, we don't know if cannabinoids cure cancer because we don't have clinical control studies saying that. We know that they work as antitumoral agents in preclinical models of cancer, and we have a lot of anecdotal reports from people saying that they have cured their cancers with cannabinoids. But from the medical community perspective, we don't have that evidence yet that cannabinoids cure cancer. But going back to Dennis's point regarding the ratio of THC and CBD that one has to take to cure a cancer, I wouldn't say that a 1:1 ratio is the need. I would say that each individual, each patient needs a particular ratio of cannabinoids, or at least that's what we have seen in our preclinical models of cancer. Not only us, but the rest of the research groups that are working on this field. What we see is that some types of tumors, for instance, glioblastoma, brain tumors, in these cases, more THC works better than a 1:1 ratio. On the other hand, in breast cancer, which is the type of cancer in which I work, we have seen that more CBD works better than a 1:1 ratio. So I would say that, and this is the case for other medicine, other anti-cancer medicines, each patient is a different situation, is a different clinical challenge. So I wouldn't say that a 1:1 ratio would work for everyone, or that it would be the best combination for everyone.
So you're saying each patient is different, or each type of cancer?
I would say each patient is different. Cancer, we use the same word cancer to define one pathology that is tremendously heterogeneous. Breast cancer has nothing to do with a prostate tumor, and within breast cancer, which is my specialty, we have so many different types that we don't treat the same way. We have different medicines, we have different prognosis, we have different therapeutic approaches. So I know it's hard to assume from the patient perspective, but each patient is a different world in therapeutic terms. So probably we can narrow the ratios when we define tumor types, but within tumor types, we will have to see each patient in particular.
Okay, and what was the second point that you didn't necessarily agree with?
Yeah, the second point was in regards of the prominent role of cannabinoid receptors in the response to cannabinoids. I mean, if I understood correctly, Dennis was saying that the responsiveness of cancer cells to cannabinoids depended on the presence of cannabinoid receptors. So in other words, if you have cannabinoid receptors in a cell, you can kill that cell with cannabinoids. But that is not 100% precise. We have some cases in which the response to cannabinoids depends on the presence of cannabinoid receptors. For example, in breast cancer, we know that breast cancer have a lot of CB1 and CB2 receptors, and that non-breast tissue has no expression, no CB2 expression. So probably in this case, that's the answer to why cancer cells die and why non-cancerous cells don't die in response to cannabinoids. But on the other hand, we have, for example, neuroblastomas. Neuroblastomas are tumors that are produced from your neurons. They become tumoral and they create tumors. These cells express CB1 receptors. So you treat these cells with THC and you kill them. But our neurons, our healthy neurons, they do have CB1 receptors as well. And when you treat neurons with THC, you don't kill that cells. And this is telling you that not everything is in the absence of cannabinoid receptors. That's not the key question. Mm-hmm. That's not the key to why cancer cells die in response to cannabinoid receptors and non-cancerous cells do not.
Okay.
I don't know if was it clear?
It was pretty clear. I was trying to focus more on the fact that the recorder is still recording somewhat. So I'm looking I'm looking at that, and I figure I'll try to make sense of it later on. I was thinking of THC is the ligand for the
if
CB1
you see
receptor.
that. I'm sorry, but if you think that something is not clear enough, just let me know and I will try to rephrase it and make it clearer for you, please.
I think you're explaining yourself very well, Cristina. Now, while we're on the subject of Dennis, I have a couple of questions that Dennis wanted to ask you, which I've emailed you before. So I'm just going to see if I can find them in my notes here. Question 1. We know that the CBD inhibits the mental effects of THC, but does this action also inhibit any of the therapeutic capabilities of THC? Do you know the mechanism of how CBD inhibits the mental effects of THC? Now, in saying that, and I'll add to that, so if you can remember that question, I also had a patient from Colorado saying, I am 71 days, his name's Steve Justino, and he says, I'm 71 days into a modified Phoenix Tears protocol in an effort to cure my Gleason 7 prostate cancer. I have built my dose tolerance up to CBD suppository 325 milligrams and CBD and 16.5 milligrams of THC in the morning and again in the afternoon, then a TH suppository 350 milligrams of THC in the evening. All oils are decarboxylated. I am doing the modified Phoenix Tears suppository rather than oils and in doses as above rather than using strictly 1-to-1 ratio, which you were talking about before, during the day to maintain a function at work. That being said, I'm a little concerned about the fact that I get no psychoactive effect from the evening 350 milligrams of THC suppository either. Whereas 140 milligrams of THC from the same strain taken orally produces an extreme hallucinogenic psychotropic effect. I know that the THC is metabolized to 11-hydroxy-THC in the liver after oral consumption, and that 11-hydroxy-THC is more potent than THC. Therefore, it makes sense to me that cannabis ingested via suppository is weaker clinically than oral, since it is missing the first pass in the liver to convert. And finally, my question: does the lack of psychotropic effect from the THC suppository mean that there is a lack of therapeutic effect as well? A long question.
No, not at all.
Oh,
yeah, interesting, very interesting question.
Good.
No,
good.
I mean, if he's 100% sure that that's the amount of THC his medicines have, I think he's doing the right thing. And the profile that oral consumption and suppositories have in terms of psychoactivity, and which is a reflection of what is going on in your blood, is completely different. So what is happening to him is completely normal. When you ingest cannabinoids orally, you have like a very slow increase in your THC levels in the blood, very slow, that is kept up during a long time, and then it goes down. When you use suppositories, the increase is still slow, but it goes not as high as the oral route, and it's maintained a little bit longer. So, in fact, that's a very good route of administration. It has some social, I don't know how to say this. I mean, people usually don't like to use suppositories,
yes.
But it's actually a very good route of administration because the increase is slow and the high levels are maintained very, very long. So that's what you want when you're taking a medicine that you want to last in your body for a long time. So I think he's using the right routes of administrations, and apparently, I mean, he shouldn't be worried that he's not getting the therapeutic effects, because the levels of THC in his blood will be maintained for a long time.
Well, that's a fantastic answer, very comprehensive, and I'm sure. And Steve Justino also has a blog which he is writing on an almost daily basis and telling people his results. So
that's very interesting.
It is. So
yeah. And especially because he's controlling the amount of THC and CBD that he's taking. So it's very useful information.
It is useful information. So going back to Dennis's question, we know that CBD inhibits the mental effects of THC, but does this action also inhibit any of the therapeutic capabilities of THC? Do you know the mechanism of how the CBD inhibits the mental effects of THC? A bit different.
Well, THC and CBD are very good friends. They get along very well together, but their mechanism of action is different. So CBD does not bind to cannabinoid receptors. THC does bind to cannabinoid receptors. Some people say that CBD binds to CB1, but it doesn't do it in the same place where THC is bound. So the effects are completely different. So in some cases, THC and CBD has opposite effects. For example, on anxiety, certain doses of THC have anxiety-like effects, and CBD can counteract these effects because it has the opposite action. And when you combine them both, you can have the therapeutic effect of THC and some of the therapeutic effects of CBD. So they work very well together. This is the entourage effect, not only of combining THC and CBD, but the other compounds that are present in the plant. And they work very well together. It's like an orchestra. I mean, probably you like the sound of violin. It sounds really nice. It's a very beautiful sound. But if you combine a violin with a cello, it will probably sound better. And if you have the whole orchestra, what you feel is completely different, because they are touching different parts of your brain probably, and when they play together, the whole brain is activated.
Okay.
And with the compounds of the plant, with THC, CBD, and the other cannabinoids that are present in the plant, the terpenes that are present in the plant, the other bunch of compounds that are present in the plant, what you have is a multi-target effect.
So this is this is the entourage effect, isn't it?
Exactly.
Now, this is I'm going to jump in here, Cristina, because you were talking about the trials with Sativex, I think you said. Now,
Sativex.
Now, this is a bit of concern for me, because I like organic, naturally grown food, and And I believe that if the cannabis oil in a pure organic essential oil does the job, why do we need to synthesize it and take different parts out of it? Why can't we have the whole goodness of this pure God-given product?
I fully agree with you, but Sativex is not made as you say. Sativex is a botanical drug extract, so they produce the compound from the plant. So it's not that they synthesize the THC, the CBD, and put them together. Right. So it's an extraction from the plant. But I fully agree with you. I mean, we need a medicine that produces reproducible effects. So if you're a patient, a cancer patient or a pain patient, you don't want an oil that one day works in a way because it has certain amount of THC and CBD, and then you change the batch, and next week you have to retest everything again because it doesn't have the same proportion of THC and CBD. That's what I mean when I say that we need a standardized medicine, something that you know which effect is going to produce on you, because you know the amount of THC and the amount of CBD. But you can have that from Sativex, which is produced by a huge pharma company, but you can also have that from a smaller company that makes the rigorous controls and tells you what's in the medicine.
I would think if you had a certain strain of cannabis and you grew it in certain conditions, you could pretty well guarantee that it was going to be a certain quality of THC CBD.
Well, I would be happier if, besides doing the same thing all over again, you have your the tests done, because you never know. I mean, you never know. Well, and for sure, I mean, you can do that for your own. But if you're going to give that to other patients, you should have your tests done. But you test, I mean, how much THC and CBD is in there.
And I totally agree, but you can test it after you grow it to make sure. Now, I have a couple of questions from myself.
Okay.
One of which is, Dennis was talking about how the carboxyl molecule needs to be taken out of the cannabis oil. Is there a method of testing if it has been taken out of the cannabis oil?
Yes, I mean, it's very easy to, once you understand why you have to decarboxylate the molecule, you will see that it's very easy to check if you have decarboxylated. What the plant has is something that is called THCA. Yep. And the A means acid. And acid, in chemical terms, we call it carboxy group. So it's a fancy way to call an acid. We call it carboxy group, but it's the same thing. So what the plant has is a lot of THCA. It's the acid form of THC.
Right.
What kills cancer cells is THC without the A, without the carboxy group. Yep. How do you get rid of the carboxy group? Heating up the oil.
Yep.
So probably when Dennis was saying that the first oil he was taking was not producing any effect because it was not decarboxylated, he was probably using a raw CBD, cannabis extract, something that was not heated up. So he didn't have enough THC.
Yeah.
So he was having a lot of THCA, which have some beneficial effects, but it's not as potent as THC in killing cancer cells. How can you produce more THC in your oils? Heating them up. And that's what most people do. If you see in the internet protocols to obtain cannabis oils, they all include a heating up step. Yep. And it's for this decarboxylation. So you convert THCA in THC. So going back to your question, how do you know if you have decarboxylated your THCA? You just measure the amount of THC you have in your oils.
Okay. So is there like a test kit that you can obtain for?
Unfortunately, there's not. I think there's one in the market, but I don't think it's precise enough to. I mean, I don't think it's reliable enough. We need very sophisticated machines to measure the amount of THC and CBD. But there are labs all over the world that can do that. So it's not that easy. It's not that difficult. Sorry, it's not difficult.
Second question, quick question. Does the oil have have a shelf life? Does it lose THC and CBD after a certain period of time?
Well, you have to keep the oils in the dark because cannabinoids are photosensitive, or light sensitive. I don't know which one you use, and you better keep them in a freezer. But other than that, they are pretty stable compounds.
Okay, great. Okay, it seems like the recorder is still ticking along.
Perfect.
And I'll just look for this next question, if you bear with me. Please explain the entourage effect of how phytocannabinoids and other cannabis enzymes work cooperatively to efficiently and effectively treat cancer. You've probably got into that a little bit from what you were just saying, haven't you?
Yeah, remember the orchestra thing I told you? I mean, the key is that all these compounds that are present in the plant, they all have different mechanism of action. So they target different things. Mm-hmm. So if you combine them, instead of using one isolated cannabinoid, if you combine not only cannabinoids but also the other compounds that are present in the plant, you will have a higher and a more potent and a wider effect. Okay. That's the key.
Okay, all right. Well, that's that question. Now, going down the list, we have another question from a David from California, whose daughter-in-law is expecting her first baby and also learned that she had stage 2 breast cancer. Does Dr. Sanchez know of any cases such as this that may have used cannabis, and what dosage is needed to fight breast cancer? Thanks for your time. Tricky question.
Well, it's a very tricky question. Dosing, any question regarding dosing is very complicated for me to answer. Yes. Well, first of all, I don't work with human patients. I'm not a physician. I'm just a biochemist. So I just work with mice, and that's the only animal that I work with.
Not quite the same. So, not quite the same as pregnant
Nothing
women, is
to
it?
do.
No.
Nothing to do. No. So, I mean, there are very good places in California where they can assist better than me in dosing. But pregnant women is something very delicate, because we know that cannabinoids go through the fetus, through the bloodstream, because when women are pregnant, they share their bloodstream with the fetus, and we know that cannabinoids travel through the blood through the fetus. So on one hand, using cannabis when you're pregnant is not such a good idea, because you know that the compounds will go to your developing fetus, and we know that cannabinoids somehow affect the brain development. On the other hand, we don't know how important the effects of cannabinoids on brain development are in human patients. We know that they do things on our preclinical models of maternal consumption of cannabis. They produce things, but it's not something really major. So there are some deficits, but it's not something, I mean, you don't have retarded kids, or they don't have retarded offspring. But they have some things. But like in everything in life, you have to put in a balance the potential risks and the benefits. And if she's fighting against cancer and cannabinoids can help, I don't know, I would use, for example, something rich in CBD, because CBD doesn't have these effects on development. And it works very well, or at least in our preclinical models, it works very well on breast cancer. So in this particular case, I would first inform the patient that it has been observed that the cannabinoids can go through the bloodstream to the fetus. And then I would suggest to use, if she wants to use cannabinoids, I would suggest to use something that is very rich in CBD and very low in THC. That would be my suggestion.
Very, very delicately answered and very informative at the same time, Cristina. Great answer for that. And I sort of agree with you, not that I know much about it, but it seems like the CBD not having such psychoactive effects, psychotropic.
Yeah, yeah. I would.
Here's another question from Crystal, and this is the last question, and I'm just going to stop this phone. Oh, excuse me. Not very professional, but that's the way it is.
It's okay.
So this is it true that THC can make certain estrogen-positive breast cancer tumours grow in certain patients, and is high CBD strains better for breast cancer? Now this is right up your alley, isn't it?
Well,
almost. Apart
sorry?
from the fact, this is almost right up your alley, they say. It's right in your field of research.
Well, that's what I work on breast cancer, and
right.
one of the types of breast cancers is one that is positive for estrogen receptors. So we have been receiving lots of mails lately regarding this particular issue, and I work on a specific type of cancer which does not express these estrogen receptors, and for these tumors CBD works really, really well. For those tumors that express estrogen receptors, there have been some reports, very few reports in the scientific literature, where they see an increase in tumor growth. But I have to say that these models were very particular. The immune system of the animals that were used in these experiments was not normal. So, I mean, we have done experiments trying to answer this question, and we have never seen pro-tumoral responses induced by cannabinoids, even in estrogen receptor tumors. But this is something we have to check more carefully, because we know that in the plant there are some phytoestrogens, so estrogens that are activating the estrogen receptors. So what we are doing is trying to work a little bit more on the preclinical models of estrogen receptor positive breast cancer to see if we can find any pro-tumoral action, but we haven't so far. And we also want to get data from patients that are taking cannabis oil to see if those that are estrogen receptor positive have a different response than HER2 positive or triple negative, which are the other types of breast cancer. So I would say, in summary, we have not seen any pro-tumoral responses in this type of tumors in our preclinical models of cancer, but we are aware that there are some phytoestrogens in the plant, and we need a little bit of more information to be absolutely positive that nothing wrong is going to happen.
Okay, a great answer again, and that's all the questions I've had. These are all questions from the patients of Cannabis site in America. So I put a little message in there that I was going to interview you, sorry, and and these were the questions that I got. One other one.
If they have more questions, you can give them my email, and I will be happy to help them if I can, of course.
Fantastic, Cristina. And well, I'd love to interview you again. You've been such a pleasure to interview, and so informative. And what was that? What was the place in Chile that we were talking about? What was the name of that?
Well, I was mentioning before a foundation in Chile. It's called Fundación Daya, D-A-Y-A. And this foundation is led by a fantastic woman, Ana Maria Gasmuri. She used to be an actress, and she gave up acting, and decided to dedicate her life to help patients using medicinal cannabis. So cannabis is illegal in Chile, but she has made incredible achievements in the last year. And for example, they have been allowed to make a huge cannabis plantation to produce cannabis oil and to treat 200 cancer patients. And in this clinical study, the university is involved, some hospitals are also involved. It's of course allowed by the government. So we will have soon the first results of a clinical study performed by, thanks to a person that decided that it was not fair to wait any longer for the patients. So I will send you the link because it's really, really interesting what they are doing and what they are achieving.
That sounds fantastic as well. I'm looking forward to looking into that a little bit more. Well, I think we can end it now, Cristina. I could talk to you for hours, I'm sure. I find it so interesting listening to your explanations on cannabinoid research, and I'd just like to say from everyone that's asked the questions, thank you. Thank you for your time.
You're very welcome. I apologize for my lousy English, but I hope you understood everything I wanted to say.
Very, very easily I understood everything you said, and so no, it was much appreciated, and hopefully I'll get to do it again.
Okay, whenever you want.
Don't say that.
Okay.
All right. Well, thanks very much, Cristina. And,
thank you.
And have a nice day.
You too. Bye-bye.
Bye, Cristina.
Bye.